thickness globulin proteins that will glob onto that. I'm Dr. David Wikenheiser. I'm a naturopathic physician and I work with people to solve their health concerns with regenerative medicine. An important part of regenerative medicine is balancing your immune system. This video is the second in my series on low dose immunotherapy. This is an important treatment for balancing your immune system. In this video, I will discuss how your immune system works. This is the basics to understanding how immune therapies work. Now, to get started, there are 5 main parts of your immune system. I want to discuss each one. The first is barriers. The first part is skin and mucous membranes. These areas of your body function to keep out infections, to repel invaders such as bacteria, viruses, parasites, and even fungus. So barriers are an important first step. Second is white blood cells. Now, these white blood cells throughout our body, there's different types for different invaders. You've got certain white blood cells for protein, the proteins based on the proteins of the parasites, also of bacteria, of viruses, and even fungus. So you've got specialized white blood cells that will go in and effectively peroxidize or bleach invaders, break them down, eat them up, carry away the debris. Third part are immunoglobulin proteins. So immunoglobulin proteins are what is ideally made by someone when they get a vaccine. Now, I'm not against all vaccines, just some that are not done well, but the issue is to have the appropriate vaccination, which could be simply exposure to an infection. Now, making sure that you're well supported with enough vitamin C, enough vitamin D, zinc, other factors. We could get into that in other videos, but immunoglobulin proteins are the second level of immune function. And when you have immunoglobulin proteins, whether it's from a vaccine, from your own past experience, they will literally glob onto an invader and help the body to identify what needs to be attacked by white blood cells. You get a tetanus shot, you make globulin proteins that will glob onto that fungus. It's the tetanus spores will be globbed onto, and the immune system will then attack. Third part are lymphatic tissues throughout the body. So lymph nodes, lymphatic system, which is a parallel fluid system other than the blood system. It moves not with pumping from the heart, but muscle movement to move this effectively white blood, because it's all the blood elements without the red blood cells. So there's little trumpets, they look like trumpets, they're called lacteals. That's where they effectively vacuum up bacteria and other cells that are being attacked by our immune system, goes into areas like the lymph nodes where they can be processed and removed. Fifth area are immune modulators. Now, this is pretty important because names like lymphokines, cytokines, and thymus cells, these modulate the immune system. They turn it on when it needs to be turned on, it calms it down and turns it off when we don't need it. So that's the thymus cells. Now, the thymus gland is under your chest, under the upper portion of your breastbone, and the thymus cells are produced by your thymus, and they support the immune system. So there's thymus, or what are known as T, capital T, helper cells. T helper cells increase our immune activity. T regulator cells, Tregs, often called by their abbreviation, Treg cells downregulate and balance an overactive immune system. Many people today are overreactive to many of the stimulation of their immune system. So let's get into an area of cytokines. This is what's known as Th1 and Th2. Th1 is a cytokine that reflects immune function within your cells. We all know that there are people with deep infections, whether that's viral or bacterial. Infections go deep and hide. They hide within our cells. And there is an immune system within our cells that when it's turned off, when Th1 is down-regulated, what that means is that the immune system is not going to attack those cellular infections. Now, that Th1, that works in conjunction, in close symmetry with Th2, which is our general immune system. And so as Th1 goes down, Th2 will elevate. Evidence of Th2 includes occurrences such as weight gain and even rashes or generalized fever reactions. So some people, you'll know that they've got a deep infection because Th1 is decreased. You'll know that because Th2 is so elevated. So to regulate Th1, you may therapeutically use a pharmaceutical known as naltrexone. We do that as a prescription from your pharmacist, and that'll bring up Th1 and calm down Th2. And then there's Th2 overreactions that will help with T regulator cells promoted through the use of low dose immunotherapy. So now here comes a second little issue in here after the whole discussion of T regulator cells comes in molecular mimicry. And this is really important for you to know because molecular mimicry, in the past known as cross-reactivity, affects all of us from time to time. And it explains some very serious ongoing disease states. Here's the classic and possibly best known example would be rheumatic heart disease, where someone's got a damaged heart valve. Now that could have come from an infection in their throat when they were younger. So if they have a strep bacterial infection in their heart or in their throat, the immune system attacks it, and there's a certain protein sequence within the bacterium that's what your immune system recognizes and attacks. Unfortunately, the heart, your heart valve, will have a subsection of that protein, and therefore the bacterium that's attacking you mimics part of your body. So with rheumatic heart disease, an immune system that attacked your immune system attacked a throat infection, and it may have cleared it out or not. Roughly 30% of all people have low-grade strep infection in their throat at all times, so it's a question really of when it flares for those people. For the rest of us, it can be fought and removed. The challenge is that immune response will go on to cause heart disease in some people. That's partly depending upon their genetics. Here's another one for you. Rheumatoid arthritis. Joint pain, hot, so that's inflammation would be pain, redness, heat, and swelling, often with weather changes. So rheumatoid arthritis can be a molecular mimicry, cross-reactivity between your immune system attacking two known bacterium known as Proteus, common with bladder infections, and you may even have a subclinical unrealized bladder infection, or a bacterium known as Klebsiella. So your immune system attacks either or both of those bacterium and then goes on to attack your joints. So your immune system is intolerant of your own joints because it's been misdirected from attacking certain bacteria. So your immune system attacks invaders, but unfortunately can be misdirected. It can be poorly regulated. It can attack yourself and create really big health problems. That's where low-dose immunotherapy comes in and helps to reset a balance and get you back to normal. So this was video number 2 in my series on low-dose immunotherapy. I'm going to go into video 3 next. It's on immune balance. I'm Dr. David Wikenheiser, and on to my 3rd video on low-dose immunotherapy.